Good afternoon, and welcome back to the Health Leaders, the Winning Edge program, a weekly series of webinars touching on the topics and strategies that you need to know most. My name is Marie DeFreitas, and I'm the Senior Finance Editor for Health Leaders, and I'm going to serve as your moderator for today's session. So today's webinar is titled The Winning Edge for Collaborating and Building Trust. Thank you to our audience for participating. Before we get started, for those of you in the live program, I just have a few housekeeping details. First, note that an on-demand version of the program will be available on our YouTube channel on Friday, and this can be accessed through our website, healthleadersmedia.com. To ensure that you can see all of the content for the event, please maximize your event window and be sure to adjust your computer volume or PC speakers for optimal sound quality. Next, you're going to find a resources list for today's webinar on the upper right-hand corner of your screen. Here we have listed the webinar slide deck and some additional materials for you to download, along with a registration link for future Winning Edge events. Then at the bottom of your console are multiple widgets that you can use. If you want to submit a question, you can click on the little Q&A widget, and this already may be open and appear on the left side of your screen. You can submit questions at any time during the presentation. However, just note that it's likely your questions won't be answered until the Q&A portion of our program. Finally, if you should experience any technical difficulties during today's program and you need help, click on that little help widget, which has a question mark icon, and this will cover all of your common technical issues. So at this time, it's my pleasure to introduce our panelists for today's discussion. First, we have Julie Soekoro, who is the Vice President and CFO of Hamilton Healthcare System. And we have Katina Williams, who is the Vice President of Corporate Finance at Johns Hopkins Health System. Thank you both for participating in today's webinar. And with that, let's get into it. Oh, sorry. So firstly, please, if you could each just tell us a little bit about yourself and your organization. Julie, do you want to kick us off on this?
Sure. My name is Julie Soekoro. Again, I'm the EVP and CFO at Vitruvian Healthcare System, formerly known as Hamilton Healthcare System, until we acquired another facility about a year ago. I have been here for approximately 6 years. Prior to coming to work in the beautiful northwest corner of Georgia, I was in Birmingham, and prior to that, South Carolina and a few other places. I was on the for-profit side for 20 years and started my career in Maryland as a CPA, went to work for a hospital there, and that's how I sort of got into my healthcare career. It was entirely by accident. Once I got my certified public accounting certificate, I looked for a firm to hire me, and the one that hired me specialized in healthcare. And here we go, fast forward 20 plus years later. Love being here. We have two hospitals in our system. We are a fully integrated network, a small IDN. We have a hospital in Tennessee and a hospital here in Georgia, and various nursing homes, and pretty much everything from birth to death, except a funeral home and a daycare. So lots of things in the middle there. So that's my story. Originally from Minnesota.
Nice, awesome. And Katina, what about you?
Sure. Thank you, Marie. So Katina Williams, I am currently the Vice President of Corporate Finance at the Johns Hopkins Health System. That's a relatively new role that I moved into as of July 1st. Prior to that, I was the CFO and VP of Finance for the Johns Hopkins Hospital in Baltimore. And now being at the health system, I have responsibility of all 6 hospitals. So the 4 in Maryland. We also have a hospital in DC, and we have an all children's hospital in Florida that I have responsibility for, in addition to our ambulatory platform, so community providers, ambulatory surgery, that sort of thing. Before going to Hopkins, I've been there for about 4 years. Before going there, I spent 21 years with the Duke University Health System in Durham, North Carolina. So the bulk of my career has been there. And as Julie mentioned about her organization, we are an integrated health system. Basically, well, we are an obligated group. And we have all of the clinical service lines that you can think of, world-renowned institution, tripartite mission. I'm very closely connected with the university and the academic mission with the School of Medicine.
Awesome. Thank you both. So today we are talking about collaborating and building trust as a as a CFO. So firstly, the CFO role has definitely evolved in recent years, and there definitely is a role where you're needed to be a very trusted partner within the organization. So our first question is, how has your role as a CFO evolved in recent years, and what areas of the organization are you now more deeply involved in beyond finance? Julie, do you want to start this one for us?
Sure, happy to. Well, I think there's an acknowledgement now more than ever around the CFO as a business and strategy advisor to hospital leaders and physicians, given the ever increasing complexity of our healthcare operating environment. CFOs are getting involved in more and more because, frankly, everything that happens in a hospital has an impact on the bottom line. Patient satisfaction, quality outcomes, physician, employee satisfaction, all of those things impact on the bottom line. And, certainly CFOs look at all of those things and try to articulate the story of the numbers and advise on how those numbers can be impacted, as well as driving accountability for those numbers quite often. And by the very nature of those activities, we tend to get involved in anything and everything, really. And as CFOs prove themselves to be those trusted business advisors, I have found that our guidance is increasingly sought after. We're also frequently the keepers of the data, right? And the data leaders need that data to drive decision making. And we're deeply involved in revenue cycle, which touches all the clinical areas. And then, of course, as we've seen permanent increases in our expense structures related to salary, supplies, purchase services, et cetera, we are increasingly having to look for operational efficiencies in all parts of our systems. So I think that's a little bit, the pressure, I think, is greater than it ever has been in the past, and at least in my close to 30 years of being in a leadership role in healthcare finance.
Yeah, I could definitely see how the pressure's been raising, especially in recent years. Katina, did you want to add anything to this one?
Sure. I would agree with everything that Julie said. And long gone are the days where the CFO sits in the finance suite, right, analyzing trends and looking at budget versus actual variances and cash flow from operations or whatever the metrics are that we track, right? But we're seen now as more of a strategic and an operational partner, which means that you're out of the office, you're engaging with frontline teams, and you're gaining a greater understanding of the day-to-day business. So we are shifting from being the historians or telling what happened, past tense, to predicting what needs to happen in a future tense and working alongside those operators and strategists to really bring the vision to life. And so I think a really good example of something that we've done in my organization is the work around the structure that we've built around performance improvement. And so we've moved from simply tracking and reporting the benefit realization to assigning team members to sit on implementation teams to help execute on the initiatives. And so it's building skills and capabilities within our internal teams to make us more well-rounded professionals. And so rather than colleagues coming to us for ideas around improvement, and we're still looking at the trends, but we're being a little bit more proactive than I think I've seen in the past in identifying what the change needs to be. And so to that end, my role as a CFO is to encourage that sort of development in a way that looks different than it did 10 years ago. And then to our other point, I also think that strategy is becoming a more prominent expectation for CFOs. And so we're being asked to evaluate decisions, not just from a financial perspective, but from a strategic one. What's the enterprise value of the decision? What impact does it have on positioning in the marketplace? What are the requirements for workforce and facilities planning? And so the expectation is that we are covering all aspects of those areas and exercising a more balanced approach in our financial discipline.
Definitely. I can definitely see that, just the role shifting from more of a strategic, big picture, forward thinking mindset at every step. So we know that trust is important for a CFO to have throughout the whole organization. So let's talk about how you guys are kind of building this trust. What specific strategies have you found effective in building trust with clinical and operational leaders at your health system? Julie, do you want to go first?
Sure. I was joking around before the call that I was going to show you all this sign. My way, highway. Don't do this, okay? That's not the way to build trust and collaboration. I just keep it in my office as a bit of a joke. But, you know, the old axiom that people don't care how much you know until they know how much you care is certainly very applicable in building trust with clinical and operational leaders. I feel like our leaders need to hear me verbalize first alignment with the core mission. And the core mission, in my mind, is quality, robust healthcare in our community and remaining an ongoing business concern. I mean, both of those things are essential to, or are the mission, in my opinion. And sometimes when I've seen a little bit of disparity in terms of the direction that our team is going, I find it helpful to recenter on what's our core focus here. It's got to be around patient care, right? And when our leaders see the CFO aligned with that patient care agenda, it's a different reaction. It's wow, she's a member of our team. She's not driving her own agenda. And we can work from a central point, right? And that is absolutely critical. I think it's important to communicate with tact and diplomacy. You can't just rely on your title to get you through. You have to earn that trust and collaboration. And that entails listening to other people, even if you have an opinion. And as long as you don't care who gets the credit, as long as you're seen as a collaborative resource who's going to help get things done, and not necessarily that you're trying to, get the credit for it, that goes a long, long way, in my opinion, with our leaders. And then secondly, the thing that I think is really critical is offering to help, right? A lot of folks are sometimes reticent to approach the CFO, and the CFO needs to be valued as a resource to leadership, right? Not just as a big stick, unless that's the particular resource you need at the time, because we can do that part too, if we have to. But it's not about trying to compete for turf. It's about how do we move our organization forward together. And as long as people know you're absolutely firm about your alignment there, that I have found that is probably the single biggest thing to building trust and collaboration.
Yeah, definitely. I could definitely see that. Even just like your presence, just being available there, knowing that you are available to help people, I think goes a long way as well. Katina, what about you?
Yeah, I would say networking, and I know that networking is pretty broad, and so it's really around the way that you network and how effective you are in that. And so are you establishing personal relationships and connecting with folks beyond the workspace, which I think is important. So how do you understand their motivations and interests, learn their personal why? It can go a long way in helping, to break the ice before those awkward and difficult conversations that we are often called to have. But it also helps to establish a common bond, provides an opportunity for them to learn more about you. I found a good way to network is through community engagement, as an example. And so you might be surprised at the number of leaders who become involved in similar activities or may be affiliated with the same organization. And it's a great way to connect outside of work. Another way is through sponsorships. And the one that comes to mind for me is because we just recently had this event over the weekend in Maryland. It are things like the American Heart Association's annual walk, right? And so becoming a team captain for one of those events. And it's just one of the many events that hospitals may affiliate with. And so you'll have a chance to support a good cause while also interacting with colleagues, because often at these events, you see clinical leaders, you see your operators and administrators in that same discipline. And so it shows support for them, for their particular service line. And then beyond engaging with the leadership team, I think that you also have an opportunity to engage with members of their team, often at different levels of organization. And to that, I'd say it's perhaps more foundational than connecting with the leader themselves, because you're establishing a positive connection with the folks that they lead, who, believe it or not, can be very influential in shaping that leader's perspective of you, right? It's how you engage with their people. And so I think that networking aspect is important. And also to Julie's point about connecting to the mission, people want to know that their CFO really believes in the mission and the values of the organization. And it's not just always about the bottom line. But there's a mission behind it as well that we should all be connected to. And so the way that we act and the things that we say and the way that we carry out our roles should always demonstrate that we are connecting back to that mission.
Definitely. I like what you said about networking too, because I feel like if the role is becoming more diverse, I think it makes sense to diversify your connections in any way you can as well. Nice.
And I think to add on to that too, if you have a common friendship, even if it's at an acquaintance level with your peers in the organization, that goes such a long way because you're operating from a basis of trust. And when you have to have difficult conversations, when you have that basis of trust where they know you're not out to get them or throw them under the bus, you're there again because you're aligned. You want to, you have to take time to build that though. It doesn't happen just by virtue of, oh, you're a VP and I'm a VP. That's not really how it evolves. You have to have those conversations. And I find it helpful to know about family, My family is very important to me. Most people's family is very important to them, and asking after their family really goes a long way, I've found, and helps build those bonds. To the networking point, Katina.
Yeah, definitely. I could definitely see that. Just like consideration and respect seem like these foundational qualities in that building of trust, for sure. So I want to talk a little bit about how you guys balance innovation and financial discipline in your roles. So Katina, I'll have you go first on this one. How do you balance the need for financial discipline with supporting innovation and long-term strategic investments, especially in uncertain economic conditions?
Yeah, Marie, I'm laughing because, this is a really tough one. And it's an issue that many, if not all of us face. And if I had it figured out, I could charge a dime for the solution and would wind up being independently wealthy, because that's just how commonplace I think this dilemma is in the workplace. And my leader often says, we are CFOs, not CFNOs. And what's by that is we really have to remain balanced in our approach. While affordability and financial sustainability are both critically important, we can't neglect the fact that innovation and striving for excellence and being best in class are what sets us apart. And I can't say that I've always been balanced in my approach, right? My natural inclination, just due to my background, I think is to go straight to the numbers. So it takes experience, but also professional maturity to train your mind to do something different. Because there are times when we have to say yes, when the current strategy is an enabler for something more profound with the potential of having a far larger or more positive impact or reach on the organization long term. So I think it's important to evaluate both the short term and the long term impacts of the decision, and recognize that as finance professionals, we aren't always making the decision. However, the work that we do helps to inform the decision. And the role that we play in providing a compelling argument is to present the facts. And while I know it may sound simple-minded, I still often find myself going back to the old approach of drawing a line down the middle of the page and evaluating the pros and cons of different scenarios, to determine, the risk of each decision against the risk tolerance of the organization. And we often sit in a room and we'll discuss the scenarios and allow the stakeholder group to weigh in on each action. And I think the really important part to remember, though, in all of it is that we have to present the facts. And so, because those are the facts that help our colleagues arrive at an informed decision. But I don't think that I have it all figured out, but there are tools that I use to sort of help me get there. And then I think the other piece is accountability. So being well connected with your executive team in a way that if you have blind spots, they can provide the constructive criticism to you and you not be offended by the criticism or defensive by it, and in a way that really helps you to have sort of a more collaborative approach and a comprehensive look at what's going on. But yeah, it's something that I think as CFOs we grapple with a lot. And I have found that scenario planning and talking it out with colleagues is really a good way to sort of help introduce more balance into the decision-making process.
Yeah, definitely. I love what you said, or I love your honesty about just saying how you probably haven't always had, a very balanced approach, but it's something that you're always striving towards. It's something that's always changing, just like in the same way healthcare is always changing. You're always pivoting strategies. Julie, what about you?
Well, I'm chuckling because 100% agree with Katina. I once had a colleague tell me that my message would have been far better received if it had been delivered in a more humble manner. And I have never forgotten that. And I tease her about it all the time. She's now the president of one of our hospitals. And it makes me chuckle because I didn't even realize, I was coming across in that manner. And, I too, like Katina, I go back to the data and the ROI. What are the facts, right? And do we understand the facts? And even if the facts tell us one thing and it informs a bigger decision for the organization or a bigger strategy, we have to recognize we might not make money on that. But to the point Katina mentioned about accountability, we should go back and check and see if it panned out the way that we thought it would. And if we find that we have set ourselves on a course of action and it turns out as more information and more data and more numbers come to light that it was not a great decision, even though it was the best decision we had at the time, given the data we had available, it's okay to back up and say, we're going to let go of these sunk costs. We're not going to dig our heels in. We're going to recognize we need to pivot. Marie, as you said, now that we have a different set of data, we can make a different decision. So I think it's important not to get locked into a course of action. Certainly you have to give it time to work, but if it becomes clear that it's not panning out the way that you felt it would, you probably need to back up and maybe pursue a different innovation or a different strategy or something else. But again, to Katina's point, I go back to the numbers. What's the ROI? And then how does it connect to our mission? I had a discussion last Friday with a member of our executive team about a service line that we were interested in, but it's going to cost us a little bit. And, is now the right time to get into that service line, or do we pick a point in the future? And those are the discussions that we have to have open, honest conversations about. And it goes back to building that trust with your partners on the team. If you can have more crucial conversations, more transparent and honest conversations if you have a basis of trust with each other. Mm-hmm. And if you're aligned and everybody's rowing in the same direction for the healthcare that you're providing in the community.
Yeah. And Julie, you bring up an interesting point about knowing when to pivot, right? Sometimes even the brightest ideas at some point may need to be abandoned because they're just not right for the organization at that time. And it leads me, to think about speed to execution. Healthcare evolves so quickly that what might be innovative today, 18 months from now, it might not be innovative any longer. And so in your evaluation, if you're looking at a project like that, but it's going to take you 24 months to implement it, well, by the time you implement it, it's already outdated, right? And so what are the other enabling things that need to happen to be able to execute on that initiative? And is the juice worth the squeeze? But I agree with you. At some point, you have to really take a look at what you're doing and you have to pivot and be comfortable in that pivot. And sometimes it is the CFO that is leading the charge or the communication strategy around having to pivot. And those can be difficult conversations. Which is why, to your point, when you've established the trust from the beginning, it makes it a little easier sort of to ease into some of that dialogue.
Yeah, definitely. I love that you brought up that point. We have a saying, my background is more writing, and we were saying in the writing community called kill your darlings, which is a little dark, but I think it applies to so many different things, like just your strategies and stuff. I feel like there's no room for, defensiveness or holding on to strategies that like clearly aren't working, especially in roles like what you two have.
I heard a great quote once. It said, "Don't hold on to a bad decision just because it took you so long to make it." And I'm like, exactly. Whoa,
that's perfect. Definitely. Yeah. So can each of you share with us an example of a time when strong cross-functional collaboration led to a significant improvement in patient care or operational performance? Julie, do you want to go first on this one?
Sure. I think one of the best examples we have recently is managing length of stay. We stood up an interdisciplinary team that was cross-functional, and it was very, very successful. It was initially led by case management, but without the tremendous buy-in from nursing, the hospitalist, pharmacy, respiratory therapy, you name it, I think we would have had a far different outcome. We actually had a consultant recently evaluate our length of stay for opportunities. He said, every organization I've been in, there's millions of dollars worth of opportunity if you manage your length of stay better. And after he had received the data and done an initial analysis, he said, "Have I been set up?" He said, "Your length of stay is outstanding." But it really was the product of a deliberate effort down that road over the past 2 years, and just the tremendous engagement and discipline on the team. I think that not only did it help us manage our length of stay, which obviously drives down cost, and since most of our payers are, DRG or case rate type payers, if you shave off those days on the back end of a stay, appropriately so, without growing your readmissions, then theoretically you've had some cost savings, right, for the same level of reimbursement. And I really don't think that would have been possible without really strong collaboration. And that came from, again, the alignment around how do we provide great patient care and have a strong bottom line, being aligned at the leadership level, that we're all rowing in the same direction. And that's why we need that level of collaboration. So I think that not only resulted in better length of stay, but also better care coordination, right? Because you've got up to minute, here's what's going on with this patient. And I think the quality of care certainly benefited from that disciplined exercise.
Yeah, definitely. And I would say I think some of the best solutions and collaboration wise are ones that not only solve the problem, but kind of strengthen the team as well, or strengthen other facets that you might have not thought of at first. And Katina, what about you?
Well, first of all, Julie, congratulations on getting your length of stay where it needs to be. We might have to do some cross collaboration on that across hospitals.
Help. Yeah. And I have to say, our case management director was a little bit of a drill sergeant in running those meetings, but it was effective. So
it worked, right?
Right.
I would say, Marie, one of the best examples I can share, and it really stands out to me because it was early in my career, and it stood out as an excellent example of collaboration, and really serves as sort of a blueprint for me. Even to this day, but it was in a prior organization, and it was very strong cross-functional sort of teamwork. And it had to do with a margin improvement initiative around reducing supply costs for the orthopedic service line. And I know many of my colleagues have been in this space and have done the exact same thing. But this example really brought together members of the clinical community, the operations teams. It was procurement and supply chain, finance, performance excellence, folks from all of those different disciplines and backgrounds. And we worked together to review data at the most granular level that you can think of, to really hone in on the opportunity, recognizing that we could develop a strategy all day long and it would go nowhere if we didn't rely on the expertise of everybody around the table. And the key to that initiative was really the surgeon engagement and having a well-respected physician champion that could influence a change in practice. So, someone that the surgeons and the other physicians really listened to, that they believed in, and they would stand behind this person, right? And because there was a physician leader that was helping to identify the opportunity and make the decisions, they were able to bring about the idea of change among their colleagues. And so through that collaboration, we were able to reduce the utilization of certain supplies. We were able to standardize vendors, and we saved money without compromising patient care, right? Because that's the important thing. As we go through these initiatives and we execute on these things, the mission, excellent patient care, all of that has to sort of serve as our true north. That's what we are, working towards, of how to make the patient care and the patient experience better. And what was important in that is that being a member of the finance team and a CFO is really demonstrating the ability to connect back to what is important to the clinician. Because in that particular case, the surgeon was really sort of leading the charge and demonstrating that you could connect back to we as finance could connect back to the mission of patient care and the vision of the organization. It really made a big difference. But that was an example of bringing folks across different parts of the organization to work on a project that, in my opinion, was hugely successful.
Yeah, definitely. It's really cool to see. Sorry, go ahead.
Oh, no, I was just saying that's a great example. Yeah.
Yeah, no, I was going to say, yeah, no, they're both great examples. I think, yeah, it just goes back to the idea of like just having a diverse team and how that can create like more diverse solutions that are more effective.
Awesome. Yeah, and if Katina had gone in there as the CFO and said, we're changing the supply item, there would have been all kinds of, uproar on her hands. But engaging the physicians in a manner where they bought into the messaging and the connection back, yeah, that was, I'm sure, very, very successful because of the way that you went about that.
And the data, being able to explain the data in a way that they could understand. Because I will tell you, our first go round where we presented data in that example, the physician said, oh, this data's wrong. Like we don't accept that the data's wrong. Go back, you have to do something different. And it wasn't that it was wrong. It's just that we had to explain what it represented. They had one idea in their mind and we had another idea. And so how do you translate to ensure that you're speaking the same language? One of the things that I've learned is that often when a physician was talking about cost in that situation, they were talking about the cost to the patient. When finance was talking about cost, we were talking about our internal cost. What does it cost us to procure that orthopedic supply or the orthopedic device, right? And so being able to translate it and explain it in a way that we could get on the same page when we communicated was also very key to that cross-functional performance and the success of the initiative overall.
You bring up a really good point, Katina, in that we all come from different reference points. Physicians have a completely different reference point than CFOs do, and nursing leaders have yet a different reference point. So the importance of cross collaboration is pulling those reference points together because, the worst decisions I make are those I make in a vacuum where I don't seek outside input. Again, back to what you had mentioned earlier about having blind spots. I don't know what my blind spots are. I need somebody to point them out. And bringing in folks with a different reference point can absolutely 100% make a project successful where it would have been a disaster if I had just said something from on high, we need to move forward with this. Yeah, agreed.
Yeah, definitely. I think, the mindset of thinking as your physicians and your nurses as like strategic partners and not employees, I think that kind of mindset goes a long way, for sure.
Katina, something else you said made me think about the language that we use. Physicians sometimes do speak a different language. Clinicians speak a different language than financial people do, or even coders, IT, accountants. We tend to be more technical in nature. And sometimes the CFO is the best interpreter for each of those areas, right? To bring that together. I have found many times in my career where I've had to interpret for one side or the other because they had a different reference point that they were coming from, and they simply didn't understand the data or the message in the manner in which it was being delivered.
Yeah. And you know what? For that very reason, we are developing our teams differently, right? So when I first started out in my career, I wish these were things that I would have known. So today, as an example, for our financial analysts, if they receive a request from a clinical department, we train them to say, in a very professional and polite way and non-judgmental way, tell me what it is you're trying to accomplish. And let's talk through the request. Like, why do you need the data? What question are you trying to answer? Because oftentimes someone will ask for something and the language that they use, if you were to go and fulfill that request based on exactly what they asked for, you would not be delivering the right thing. But having that conversation and that dialogue and trying to figure out what's the business need, the question that you're trying to answer, I think has really prepared our analysts and propelled them right to have that next level of critical thinking. Because sometimes they will say, "Oh, that's the question you're trying to answer. This isn't the data that you need. Then you need this data here, and that will more appropriately answer your question." Or we already have something that addresses that question, and so I now don't need to go and do additional work in helping you to solve that problem because we have something that's already on the shelf that will answer the question and potentially fit your needs.
That's great advice to train the analysts at that level.
Yeah, definitely. I would say that's a great insight. So I do feel like we can't talk about collaboration and staffing without talking about labor costs and how these have been rising in the past few years. So with rising labor costs and workforce challenges, how are you guys working with HR and your clinical leadership to develop sustainable staffing and compensation models? Katina, do you want to start us on this one?
Sure. I will tell you, our approach has evolved and it continues to evolve, but in a very good way. We have employed different strategies over the years. Some have been successful, others not as successful. But like one of the examples of a success story was establishing an internal staffing agency, right, to reduce our reliance on third-party agency. And we didn't have a supplemental staffing pool or float staff, as some folks call it, until just a few years ago. And so because of those two things, we are beginning to see significant reductions in our premium labor costs. We still have opportunity, but certainly executing on these initiatives has put us in a much better place than we would have been. Most recently, we integrated members of our nursing business office, as an example, into our finance team. And we did that to foster a more collaborative relationship relative to things like establishing labor and productivity standards. And then from a monitoring perspective, giving us a greater level of accountability across our inpatient units. And so in addition to that, we also thoughtfully partner with our chief nurse executive to understand where we have areas of opportunity for performance improvement across the enterprise, so a more global strategy. And she is at the helm with us, delivering the message around expectation, which really helps because it demonstrates that we are coming at this as a united front and that we've considered other perspectives other than just the finance perspective. And then as it relates to HR, we've established quarterly meetings with our HR colleagues in each affiliate hospital CFO. And in these meetings, they're designed to educate, but also formulate strategies around segments of the workforce that we consider to be at risk. So whether it be due to labor shortages or market competitiveness from a compensation perspective, or areas where we just simply have high turnover or high demands. And while we aim for a consistent approach across the health system, we really rely on that partnership with our HR colleagues to help level set for us in realizing that our hospitals are in different markets, as an example. And so what works well for one may not work well for another. And so they help to keep us honest. And they are key for ensuring that we aren't unintentionally competing with ourselves in the same labor pool. They come to us with industry trends. They consult with external firms. They look at benchmarking data, and then they will make recommendations on their findings. But the beauty of these quarterly sessions now is that once they've done the background work, they share the results with the CFOs, and then together we put forth a comprehensive recommendation to our senior executive team based on reasonability and affordability. So no one team is making a decision in a vacuum. We are coming together with the meeting of the minds. They have their data and findings. We have our data and findings, and we put it together and come up with a comprehensive plan.
Yeah, definitely a great example of teamwork for sure. Julie, how about you?
I feel like our HR executive and generally just our director or leadership teams have really done an outstanding job collaborating together. We have articulated how expensive turnover is on the team. So what do we do to not only recruit great talent, but also retain them? And I think that we have put, we have made some deliberate investment in keeping our wages competitive. You know, it can't be an arms race. We're not going to be the highest paid in the market. But we are competitive on our wages, and it's really a partnership, right, with between the CFO and the finance team and HR and the leadership. We've developed an extern program, actually a few different extern programs where we have stood up nursing, respiratory, most recently an imaging extern program. So that helps us kind of lock in those students to come to work to us when they finish their degrees. And also sometimes in nursing, you know, you might think you wanted to be in the ER, but find out that really the better fit was labor and delivery. And so it gives the students, you know, a chance to experiment in different areas, be exposed to different areas of the hospital to figure out what a good fit is, which is better for a long-term retention strategy. Something that one wouldn't necessarily think of that has played into our retention, we hear over and over again, well, they fix their equipment. And don't underestimate the importance of those little things, right? Keeping well-functioning equipment. Nurses notice things like that, right? And so that gets us a lot of kudos. And it's just part of our, you know, it's part of our daily operation that we're going to remove the equipment that they, you know, so they don't get frustrated going to find a blood pressure machine that works, you know. We also have a referral program for our associates as well as tuition reimbursement. Of course, a lot of organizations do that. In order for us to really sort of promote the fairness of how we evaluate openings and additional positions, we actually have a workforce management council that meets every other week, and it's a team comprised of various leaders that represent ancillary, clinical, the physician, enterprise, and ambulatory, and then leadership. I'm an advisor. I'm not a voting member of the Workforce Management Council, but I generally, you know, will feel free to weigh in, and we have very open and honest conversations. I even bring my positions there. And we evaluate if you're not meeting your productivity standards for the last 3 pay periods, if you're not at 100% or better, and you have a replacement position, it has to go to Workforce Management Council. And if you have a new position, it has to go to Workforce Management. And then that way, you are not having this situation where, oh, nursing gets everything they want or finance gets everything they want. No, it's a very fair and equitable way. And if you haven't brought a compelling argument and rationale and an ROI for that new position, then you probably shouldn't expect for that position to be approved. So I think that that's been very, very helpful for us.
And Julie, we have something similar with the Labor Collaborative Committee. And I will tell you, one of the other things that it's a byproduct of having that committee is cleaning up the data, because people now have a greater awareness of what's being evaluated in those discussions. And because everyone has to bring their positions through that meeting, looking at your productivity, and if something is wrong in your actual data, well, guess what? You're working with your finance partners now to try to clean up that data anomaly, because you know that when you go to the labor collaborative, if that data is incorrect, it could mean the difference between you getting an approval to move a position forward and not. And so it's helped that committee alone has helped us in so many other ways as a byproduct just having that formalized structure.
Yeah. And the peer accountability that goes along with that, you don't just get to say your data's wrong,
That's
well,
right.
I can't get the position, it has to, you have to work through it. So I think that that's been very, very effective for us.
Definitely. Great points. Just a little reminder to our audience, if you do want to submit a question, you can still click on that little Q&A widget at the bottom of your screen and you can submit through there. So I do want to touch on transparency a little bit, which we did touch on a little bit at the beginning, but can you talk to us about how does transparency play a role in your leadership approach? And how do you kind of foster that culture of open communication around financial goals and performance? Julie, do you want to go on this one?
Sure. I probably err on the side of being more transparent than most CFOs, because people need to be able to connect the dots, right? If they don't understand, back when you were talking about reporting, Katina, and having the financial analysts probe for the whys, I think it's really important to have a culture where I'm not hiding where we're standing from a financial standpoint. All of our leadership team knows exactly where we are, and we're all rowing in the same direction, or we should be. If you can't row in the same direction, you probably don't belong on the rowboat, So that is critical for alignment. And I have a sign on my desk that says, everyone's thinking it, I just say it. I do find myself sometimes saying things out loud because not everyone has thought about the obvious. And sometimes I'm wrong, but without me being transparent about the reference point I'm coming from and the opinion I have about something, then it can't be refuted, right? Unless I verbalize it. So we need to bring in diverse opinions and diverse points of view in order to make the best decisions for our organization. So transparency, as long as you've connected the dots, you've educated your leaders on what the data means, and you're all rowing in the same direction, I think transparency is super important.
Definitely. Katina, how about you?
Yeah, I have to laugh at this one, because I think transparency is a skill and it's an art. And it's interesting because right before this call, I had a meeting with one of our internal communicators, and a comment that was made was that, you can have the best strategy in the world, but if you don't know how to communicate it to people, it's ineffective. And I believe that. So communication, both in what you say and what you don't say, it really shapes a person's opinion of your trustworthiness, but also of your competence. And so as a CFO, I strive to be perceived positively in both areas, right? Yes, you can trust me, and yes, I know what I'm doing. But one of the ways that I ensure that I am delivering the right message is by working with the experts, right? So the people who know how to deliver a message, and they are trained and skilled at this. And I rely a lot on our internal communications resources. They are excellent at it, and they provide sort of a framework to be able to deliver messages, particularly tough messages or ones that you anticipate are not going to be well received. And so they will ask me, Katina, what are you trying to say? Who are you trying to say it to? And what do you expect to happen once you've delivered the message? So they help me communicate the why we need to achieve a certain operating margin, as an example. They help me to communicate, how we can partner together to achieve it, and the specific actions that I anticipate. And more importantly, what alignment looks like. So the what's in it for me from the other person's perspective, And so I really like working with our communications team because they will kick the tires at a message and say, I know you think this is what you're saying, but this is what I heard. And so helping us tweak the language so that we are getting the right points across. Because to Julie's point, you want to be transparent about the financial position of the organization, what headwinds might we face, what are the risks and challenges, what are we going to expose ourselves to. These are all messages that we have to communicate, and oftentimes we are put in positions where we are communicating messages that might not necessarily be doom and gloom, but the trajectory may not be as bright as we would have hoped. And so we have to figure out, how do we soften the messages and communicate them in a way where we're getting the right point across, but we're doing it in a way that it doesn't incite fear and anxiety amongst our colleagues.
Good point.
Yeah, definitely.
I like being an alarmist. We can all be alarmists, but you have to be very cognizant of how your message is received. That's an excellent point, Katina.
Definitely. Yeah. And I like what you said, there's like kind of an art to transparency, and even like leaning on your connections within the organization, feeds into even something that you may think is really simple, like transparency like this, but I think there's always more to it than you initially think.
Mm-hmm.
So I think we have one last question for you guys. Oh, sorry, we have two. So as a strategic partner to the CFO and the executive team, how do you ensure that the financial data is communicated in a way that drives alignment and informed decision-making across the departments? I guess kind of starting from the top down. And I think, sorry, Julie, do you want to go first on this one? Sorry, I wasn't sure who went first on the last one.
Sure. I think it's a continually evolving process. I think that it's a process that's always underway at our organization. I always feel like we're not putting enough of the right data into the hands of the folks who need it. But it begins with telling the story, though, why the numbers are the way they are, what do we need to do to change them, and then asking your leaders the question, what information do you need to be successful as the CEO of your own individual areas? Because that's really what you are. And what information are you currently receiving that you don't understand? Mm-hmm. And how can we help explain it to make it more meaningful, or in another manner that makes more sense to you? One must understand, again, that finance team members often speak a different language than the clinical team members, and interpreting between the two and getting to the why and connecting those dots is really important.
Definitely. Katina, what about you?
Yeah, I would say the key that I found to this is knowing your audience and reading the room. So as an example, we have routine meetings with nursing colleagues, and we tailor those discussions and presentations to look at data in a way that's not too detailed, but also not so high level that we miss the areas that where we would like for them to engage. And so we might look at labor and productivity variances as an example with this audience. And then we have different forums where we may meet with departmental managers. The information there might be a bit more granular because we want to hone in on actual variances for very specific accounts. But I would say by far, one of the more impactful forums for us is when we meet with our clinical department chairs and chief administrators. And so twice a year, we will host a finance town hall with that group. And we not only discuss at a high level our current performance and key indicators, but we also weave in topics around growth strategy, payer relations, reimbursement updates, that sort of thing. And we don't typically expand the invite list beyond this group because we found that the more intimate the setting is, it facilitates more conversation. So I may introduce a topic, share a few data points, and then I'll engage in a conversation of what was just presented, ask, probing questions of that team. And it helps us to ensure that the message was delivered and received accurately. But it also gives us a level of appreciation of how the departments are internalizing or personalizing the message and the impacts on their book of business. And so that way we can work together on a solution or a strategy.
Definitely. Well said. And I believe now we have one last question for you guys before we wrap up here today. So, what advice would you give to emerging CFOs or finance leaders who are looking to become more effective collaborators and trusted voices within their own organizations? Katina, do you want to start us off on this one?
Sure. We've touched on a lot of the points in today's conversation, but first and foremost, I would say just get out and meet people. You really need to be viewed as an engaged and an approachable leader. And as a CFO, you have major responsibility that often involves, working across the aisle with different departments and with colleagues who may or may not share in your same philosophy, but nonetheless, these are individuals that you have to work with. So I think every opportunity you have to demonstrate how your work adds value, but more importantly, how it connects to the mission is one step closer to establishing the trust and becoming a more well-respected leader.
Definitely. Julie, what about you?
Really good points. Folks need to hear the CFO verbalize their alignment with the mission. And also the importance of having a positive bottom line. I mean, I think that's a message that the CFO probably gets across more clearly than anyone else in the organization. And you have to back that up with your actions, right? You have to show that you're collaborative. Again, to your point, Katina, being engaged and approachable, that is really, really important. Don't expect respect because of your CFO title. You still have to earn it. You still have to earn the credibility by demonstrating you're a trusted partner. And also you have to be willing to have the tough conversations when others avoid those tough conversations and the transparent conversations. And if you can deliver those with tact and diplomacy because you're aligned and you have that base level of trust, to the conversation earlier, I think that all of those things are key. The alignment, the transparency, and being a resource, being a trusted advisor. And folks knowing that you'll have their back because you're all rowing in the same direction. I think those are all critical.
Definitely. All really great points. So as we're about wrapped up for today, I want to thank you both for an excellent discussion. I'm not seeing any audience questions. So since that's all the time we have for today, in closing, I just want to note to our audience that our next Winning Edge program is going to be on October 21st, and that's going to cover the Winning Edge for revolutionizing revenue cycle management with AI. And a live clickable link is going to appear at the close of this program, and that will take you to the registration for that event. Remember to follow along all week for continued coverage on collaborating and building trust on our website, healthleadersmedia.com. And I want to thank our panelists once again just for an excellent discussion. I think we had a lot of great insights today. And finally, thank you to our audience for participating. I really hope you enjoyed today's program, and we look forward to seeing you at our next Winning Edge program on revolutionizing revenue cycle management with AI. Thanks.